The symptoms of a stroke, also called a brain infraction, can happen at any time, during any activity, and even during sleep, and depending on which part of the brain is affected, it manifests itself in different ways. This is your Health in Minutes channel. If this is your first time, subscribe to the channel, turn on the notification bell and click on the like button. A cerebrovascular accident, stroke, can happen when there are problems with the blood supply to the brain, causing cell death, which causes parts of the brain to stop working properly. There are two main types of stroke: ischemic, caused by interruption of the blood supply, and hemorrhagic, caused by bleeding. Know the 10 signs and symptoms that you are suffering a stroke. Numbness. A person may experience sudden numbness in the face, or loss of feeling in the hands, feet, arms, legs, or other extremities. This numbness can also feel like tingling, or a feeling of light pins and needles. It is also common for stroke to cause numbness on one side of the body, while the other side functions normally. Decreased sensitivity, and isolated tingling, in one of the limbs, or only in part of them, is not usually a sign of stroke, but of injuries to peripheral nerves or the spine. Stroke usually causes paralysis, and decreased strength. As you observe the sleeping person, you may notice that he is constantly touching, massaging, or shaking the numb area. Mental confusion. The patient may not understand what is happening, or may lose the ability to think clearly. Changes in speech can also occur due to disorientation and confusion. Patients may lose track of time, and be unable to tell what year or month it is. You may also become spatially disoriented, and not recognize where you are. These changes are common in small strokes, in the elderly. Multiple mini-strokes can lead to dementia. Difficulty to understanding. While similar to brain fog, individuals may have more difficulty understanding speech, language, or numbers. When you observe someone who is difficult to understand, you may notice that they frown, shake their head, say no, talk less, or feel insecure. Severe headache. The person may experience a sudden, severe headache in the head, scalp, or neck. This usually occurs without a known cause, and in people with no family history of headaches. As a stroke affects the brain, a severe headache can alert you to seek medical attention, as it is one of the first symptoms. In the context of stroke, the reaction time is crucial for the initiation of treatment, and for the occurrence of outcomes free of sequelae. Loss of balance. People who have had a stroke may find it difficult to walk. This change in gait can be caused by an imbalance, a decrease in strength in one of the legs, or even a change in motor coordination, responsible for the action of walking. In the latter case, the patient maintains strength in the lower extremities, but walks in coordinated measurements are difficult to take. In some cases, a stroke can cause dizziness, making the person unable to walk because of the dizziness. However, the most common patient does not feel dizzy, but still cannot maintain balance when walking. In fact, patients may not even be able to sit still and, without support, will fall over on their side. Facial paralysis. Unilateral facial paralysis is another classic stroke symptom. A deviation of the mouth on the paralyzed side is the most common and obvious sign. In a stroke, the paralysis usually preserves the upper part of the face, and patients are able to frown and raise their eyebrows. Other signs and symptoms that favor a stroke over Bell's palsy are loss of strength in other parts of the body such as the extremities, changes in speech, loss of vision, loss of balance, or any other symptom normally associated with a stroke. Bell's palsy, on the other hand, only affects the face. In some cases, facial paralysis is more hidden, and may go unnoticed by family members. A trick to see if the mouth is deviated is to make the patient smile or whistle. If paralysis occurs, it is easy to identify by means of these operations. In coma, a sign of the severity of the stroke is a decrease in the level of consciousness, sometimes falling into a coma. Loss of consciousness is usually a symptom of a severe or hemorrhagic stroke. This is a bad prognostic sign. Trouble speaking. Another classic symptom of stroke is changes in speech and pronunciation. Stroke sufferers develop a spectrum of disorders that culminate in difficulty speaking. The two most common disorders are aphasia and dysarthria. Aphasia is the sufferer's inability to name objects and things. The patient cannot speak normally, because he cannot call simple names, such as colors, numbers, and objects. In some cases, patients cannot even repeat a word spoken by family members. Dysarthria is another speech disorder, which presents itself as difficulty pronouncing certain words. The patient understands everything, but does not have motor skills to move the language muscles in order to pronounce correctly. The patient is even able to name things, but speaks in a way that is not understandable, and sometimes incomprehensible to those who are listening. Convulsive crisis. Some cases of stroke manifest as seizures, which are generalized motor tremors associated with loss of consciousness. The convulsive crisis can be one of the symptoms of the stroke, but it can also be a sequel. Some people develop epilepsy after a stroke. Nausea and vomiting. However, a stroke can also occur without manifesting any noticeable symptoms and be detected during examinations performed for any other reason. People most likely to have a stroke are those who have high blood pressure, are overweight, or have diabetes, so it's important to see your doctor regularly to avoid these complications. After a stroke, the individual may have sequelae, which may be temporary, are very serious, and due to lack of strength, for example, may prevent him from walking, getting dressed, or eating alone. Like other neurological disorders and heart disease, stroke has several risk factors that can be prevented and controlled. If people know their risk factors and seek medical help, they can greatly reduce their chances of having a stroke. It is important to keep all components of your health under control, check your blood pressure and cholesterol regularly, not smoke or consume alcoholic beverages, avoid excessive salt consumption, maintain a healthy diet, and practice some physical activity. Physical activity not only helps people maintain healthy weights and lower cholesterol and blood pressure levels, it is also beneficial for the brain. It is recommended that seniors participate in physical activity for 30 minutes to 2 hours a day. In addition, other consequences of a stroke include difficulty communicating or understanding commands, frequent choking, incontinence, vision loss, and even confusion and aggressive behavior that can make it difficult to socialize with family and friends. It is important to know that there are treatments that can help reduce the consequences of a stroke. Physical therapy sessions can help you get back in motion. Speech therapy sessions can help restore speech and improve communication. And occupational therapy sessions can help improve the quality of life and well-being of people suffering from a stroke. In order to avoid these consequences, the most important thing is to prevent the occurrence of a stroke. I hope you liked it and click on the like button, subscribe to the channel, turn on the notification bell, and don't forget to share the video with your friends and family.